professional, creating professional at will. Also reducing the process of the employee grievance process. We streamlined that to eliminate a lot of this problem of positions being in a grievance status for over a year. So we did receive a report from Deltex under the Department of Health, and they indicated to us that there are several positions that are under the grievance process that they cannot hire an individual. And that is one of the areas for its interrupting services to our grandparents or elderly out there. And we continue to have this problem of trying to provide that service of need for our grandparents. And the response was that these positions, some of these positions are grievance process. So I know Honorable Helena Ned has indicated, I don't even know why we have a grievance process, because at the time before she became a council delegate, she indicated that she did submit grieving documents for her previous employment, again, which was under Deltec, and she never received a response. And she is figuring out that, why is it that we even need to have a grievance process when we don't even hear wording back regarding grievance or responding back to those individuals that are in the process of grieving their position, which has its own ripple effect. Of course, that how it has its own ripple effect. So that's the reason why we called on you. If you can elaborate more in regards to the grievance process through the Health Education and Service Committee, and to find out how many more positions are in the same similar situation that we are hit with from Deltex. I think those are some of the things that my colleagues here in my committee would like to have an understanding of. So I appreciate you coming and joining us, even though it was a last minute deal thing. I know you don't have a report. We understand that, but we wanted to resolve kind of trying to find out how we can start having positive positions filled for Delta. How do we move forward? And when are you going to address those grievances that are in place with your office regarding the Department of Health? So that's where we are at. Again, thank you very much. Yeah. The floor is yours.
Okay, thank you. Honorable members of the committee, Office of Legislative Counsel, guests, and others, just want to acknowledge two other members of our DOJ team in our litigation unit, Mr. Louis Millette, and relatively new hire, Tamara Sakija, right here. And I have been listening to this entire conversation, so I think I have an awareness of the issues presented. And I know there was one particular position, which is a high-level supervisor position in Daltex, that had been not able to be hired for some period of time. Now, several or most of nation employees, so you have some understanding of the system. But of course, the grievance process is set out in the Personnel Policies Manual for executive and legislative. Judicial has their own manual, they have their own process. All the enterprises, LGA certified chapters also have their own process. But for Daltex and any other executive or legislative office, you are going to fall under the Personnel Policies Manual. Now, before 2014, an employee could go two different places under two different processes, one which was much longer than the other. You could go through the Personnel Policies Manual and you had to file your grievance from whatever happened to you, suspension, termination, whatever it is, within 5 days of when it happened. So if you were fired, you had to file your initial step one grievance within 5 days. Or you could go through the ONLR Labor Commission process, which was a much, much longer process because you had an entire year to do the first step, which was just to file a charge with the Office of Navajo Labor Relations. ONLR then had 6 months to decide what to do with it. No matter what they did with it, you could go to the Labor Commission anywhere. And you had a year from when you filed your initial charge with ONLR to file with the Labor Commission, which means already you have 2 years, right then, just to get before the Labor Commission your complaint, much less a hearing, much less a resolution within the Labor Commission. So the Nomination Council in 2014 said, because of all the issues you're mentioning about filling positions in the nomination government, let's try to streamline that process. So what it did is it said, you can no longer go through ONLR and the Labor Commission if you are a central government employee. But then this committee, the prior members of this committee, amended the manual to extend the time more than had been previously in this. So now that everybody has to go through this PPM process to OHA, instead of 5 days, it became 20 days. And to be clear, 20 working days, not 20 calendar days, right? Which adds a bit, that's almost a month, to file your initial step 1 grievance with your immediate supervisor. Let's say you were suspended or you were fired. You then have 20 working days to file your initial step 1, which is a written grievance that says, I think you should reconsider this decision. Okay, fine. The supervisor has 10 days to decide what to do with it. They can meet with the individual, or they can simply say, I've reviewed my materials. I've decided to sustain my decision. Okay, fine. That's then communicated to the employee. The employee then has 10 days to go to DPM to file a step 2 grievance. We're not even at OHA yet. We're still at DPM. DPM is supposed to schedule a meeting, which is like a mediation meeting, and they're supposed to do it within 10 days. In reality, for various reasons, that has not happened. Whatever happens in that meeting, unless they resolve it and settle it, the employee can file with OHA, the Office of Hearings and Appeals. Okay. That's when DOJ comes in, because we then represent the program before OHA. OHA currently only has 1 hearing officer. And as you know, OHA hears land disputes, tax disputes, TANF disputes, election disputes, and employment for the entire legislative and executive branches with 1 hearing officer. Now, we can't control when OHA schedules the initial pretrial hearing. That's the first thing they do. That could be in 15 days, 30 days, 45 days from when the employee files with OHA. DOJ has nothing to do with that. That's scheduling by OHA. And then whatever is decided in that pretrial conference, OHA then schedules an evidentiary hearing. Again, given its docket, that could be 30 days, 45 days, 90 days. It just depends on how much is going on, right? Then whatever happens in that evidentiary hearing, whoever loses, well, first OHA has to issue a decision based upon the trial. That could be another 15 days, 30 days, 45 days. We can't control when OHA issues its decision. The party who loses can then appeal to the Navajo Supreme Court. So now you have the appellate process. In theory, in 2014, the Navajo Nation Council said, Supreme Court, you have to decide these cases within this very short period of time because it's holding up opening this position. Either the employee will be reinstated, right? Because it turns out they were correct, that their disciplinary action was unfair, whatever it may be, and they're put back in the position. Or the termination is sustained and then the position is open. But that depends on how long the Supreme Court is going to take to make that decision. Now, I will say, as an objective matter, we have appeals pending in the Supreme Court currently on employment matters, going back 2 years, going back 3 years, without any action at all. Not a hearing, not a decision. Some of them are waiting just to begin briefing, because there's a rule under the Navajo Rules of Civil Appellate Procedure called 10B. Once you file your appeal, you wait for the Supreme Court to issue a 10B notice. That 10B notice says you can now start filing your briefs. We have some cases where we haven't even gotten a 10B notice since June 2022. So we can't do anything about the fact that the case is not moving forward because we're waiting for the Supreme Court to say, you may now begin briefing the case. So that's how long the process is going right now, despite the best ideas of the council in 2014, when it said, you need to get these grievances resolved quickly. However, who wins? You need to do it in an expedited manner so everybody, the supervisor, the employee, knows who wins, who loses, who's coming back, or who's not. Now, that was the intent. The actual implementation, we haven't seen that for the reasons that I've talked about. We can only control what we as attorneys for the supervisor can control, right? We turn in our stuff. We show up when OHA says to have the hearing. If we appeal, we wait for the Supreme Court to tell us, okay, now begin briefing. Or if they appeal, we wait for their brief, then we get to respond. But then the Supreme Court has to schedule a hearing. And then the Supreme Court has to make a decision. That can be 6 months, 8 months, a year, 2 years. And as I say, and I'm not criticizing any particular individual, but as of right now, the Supreme Court, as we said, are holding on to some cases where they haven't even issued a 10B notice yet. Okay. Now, why is this important? There is a provision also in the manual that says, if there is a grievance pending, you cannot do anything to that position until the grievance is resolved. You cannot advertise it. You can't fill it. You can't do anything. So if we're talking about 20 days plus 10 days plus 10 days, plus a hearing, plus a decision, plus an appeal, plus a year or two, I have been informed by employees of DPM, there are certain ones that are pending on appeal for 3 years, and the position has been frozen with no action that can be taken for 3 years. Now, the particular situation you're talking about happened within calendar year 2023. Now, obviously, this is a confidential personnel matter, so I can't say too much about the specific situation, but it is close to being resolved. I can say that. And therefore, that will open it to advertisement. But unless and until it is resolved, we haven't even had a hearing before OHA yet. Until that is resolved under the current provisions of the PPM, Daltix can't do anything. It is frozen, right? And so if we were to litigate it and we had a hearing and waiting for OHA, and then we didn't like it, and then we appealed it, that means it's going to be frozen for years, potentially. And that has happened. I've been doing employment for DOJ for 15 years. I'm the employee who's done it the longest. We multiply 3 years for every year. So like 45 years, it feels that I've been doing employment law. And I have seen positions that have been frozen for so long that the program just says, you know what, forget it. I'm going to defund that position in the next budget cycle, because why bother? It's just sitting there. The money's going to lapse in the personal lapse fund at the end of the year. You know what? I'll just live without this position, right? Now, having said that, there is a process, as Ms. Woody and Director Nesmanuel is aware, where we are proposing amendments to the PPM, which will then appear before this committee. One of the provisions I would like to see personally revised is that particular provision that says no matter what, as long as the grievance is pending, however long it's pending, even if it's pending in the Supreme Court, which we have absolutely no control as to how long that's going to take, you can't do anything with that provision of that position. I personally believe it's too extreme and it causes the problems we're talking about here, because then the program and DOJ and the employee have to think, how much is it worth it for me to work through this very long process, even though we believe it was correct to terminate someone because they stole money, or they sexually harassed somebody, or they did some act of misconduct so bad they deserve to be fired. But do we want to litigate this thing for 5 years and not be able to do anything with the position? Or is it an incentive for us to, okay, well, we'll just settle, right? Because at least the position will be open soon and they can fill it. So those are the kind of, tensions that we have when we deal with programs with the current process. I don't know how much shorter on paper we can make this process. 5 days versus 10. I mean, really, does that really make that much difference when we have no control as to how long it will take these courts and tribunals to make decisions? We don't have any real power over that, other than to settle a claim we shouldn't settle, because that would mean we would at least be able to open the position, right? So anyway, not to belabor, I know you've been here a while, but that's generally my sort of overview of where we are. Can things be changed? Yes, that provision particularly. Can we tighten some of the timing? Yes, but we can't control OHA only has one hearing officer, and we can't control what the Supreme Court does. And so there are external forces that also put pressure on this problem, that simply changing timing on a piece of paper isn't going to do the positive developments that you need to get those positions open to hire people. Thank you.
Thank you. Thank you very much. And then welcome. Good to see you. And then good to hear that we do have a new staff at DOJ. Thank you very much. And the rest of the team there as well. So with that committee there, you have the information coming from the Department of Justice, just in regards to positions that are in the grievance process. So with that, we do have a question for Mr. Tom Graham.
Yes, sir.
Why does the Supreme Court get involved?
Mhm.
I'd like to know.
Sure.
And also, how many of some of the issues or the rules that needs to be amended? That's the only question I have, so. Yes.
Okay, thank you, Honorable Paul, for that. And Mrs. Graham?
Yes, thank you, Mr. Chair, Honorable Toth. So the Supreme Court gets involved because everybody has a right to an appeal, right? So that's in Title II in the Office of Hearings and Appeals. It's also in the Navajo Preference and Employment Act. And so it says, if you go through this process, whoever loses at OHA has the right to then seek review, because you're saying OHA applied the law wrong. It misinterpreted the PPM, it misinterpreted the NPEA, so we think you need to fix it. So I have the right to appeal that decision of OHA. And so that's why the Supreme Court gets involved. It's a statutory right to appeal any negative decision that affects you, right? Now, in terms of the rules, at least, I've made a couple of suggestions here. Revising that provision that freezes the position no matter what, right? Pending the resolution of the grievance. Because as I say, at least from my view and my experience in the last 15 years, there's only so much you can do to make the system go by quicker and quicker and quicker. Why should the program suffer by having it frozen pending the outcome? Now, so that's my short answer. Thank you.
Thank you. Honorable Vice Chair Jermaine Sanderson?
Hi,
Yes, ma'am.
good afternoon, thank you. So while the position, or while the, that position is going through a grievance process, so does it vary depending on the situation, whether the employee is still getting paid or not?
Okay, so it depends. I mean, there are a number. I'm sorry, Mr. Chair, can I answer the question? Pardon me. Thank you. It depends, as you say, on, are they suspended? Are they fired? Are they claiming harassment? Right. It all depends, because there are a number. Have they been hired? Have they not been hired? And a violation of Navajo preference, or there's even the provision that the best qualified Navajo should be hired among Navajos. So it just depends. And you're right, the timing and whether they're getting paid will depend on what type of claim it actually is. Now, if they're terminated, they're not getting paid because they've been fired, right? If they were suspended, without pay, they're not going to get paid back unless and until we settle, or OHA and the Supreme Court says you were wrong to suspend them, then they get back pay back, right? But if it's a harassment claim, they're still being employed anyway, and they're a continued employee, and they're asserting emotional damages or whatever it is. So it definitely depends on the type of claim.
members, are there any other questions? Honorable Dr. Linden?
Yeah, there's, thank you for elaborating on the topic. If you're able to answer. By that I mean like, it's just for litigation reasons. How many current employee positions currently frozen across all positions of that? Thank you, Chair.
Thank you, Honorable Dr. Linden. Committee members, are there any other questions? If not, I will give the floor back over to Graham to respond to Honorable Dr. Linden.
Thank you. I don't have that information. DPM might. Thank you.
Thank you. Committee members, are there any other questions for DOJ? Oh, other questions? My only thing is, for him, when will you be able to share your ideas, the recommendations or the changes that should be made? There will be a good time for you to share that information with the committee. Honorable, Graham?
Yes, thank you.
Honorable.
I'll take honorable or dishonorable, depending on, how you feel. But anyway, after this presentation, but I will say we are working closely with DPM and with DHR. There was actually supposed to be a meeting today, but we all showed up here positively to give you the appropriate information. So there's supposed to be a meeting tomorrow. And my understanding is we are all dedicated to putting together a comprehensive package that will then be presented to you. So I would expect that to be pretty soon. Yeah. And as this conversation shows, it's essential to move that forward and do what we can, right? What this committee obviously can to help us expedite all of this to get where you need to go. Yeah.
Good. All right. Thank you. Committee members, any others? If not, yeah, thank you
Okay.
again.
Thank you.
Enjoy the rest of your afternoon.
Thank you. And if we might be excused, I can listen on Zoom. Thank you so much.
Thank you. Okay, you have a motion second on the floor. DPM didn't respond back to the questions and the comments that were made. We did do follow-ups. But again, we are here and we received a lot of great information. So I'm thankful of that, but before I call for a vote, I'd like to go back to Mr. Lewis. Providing that information to us, you indicated 10 minutes, but I think we gave you over an hour to get that information for us. Mr. Lewis?
Thank you, Chair. In regards to your question regarding our count per funding agencies. For our Title III, according to our area plan, we project to serve $32,375 that are eligible at 60 years plus. For our Title VI, it goes on a different route. We're projected to serve 265,740 males. That's either a congregate setting or home delivery mail. Within our the 3-year contract. So within that 3 years, that's what we're projecting to serve for that 3-year cycle. And then for our House Bill 2, this is where it gets tricky because the age limit for New Mexico goes down to 50 years old. So that number is going to, we're projecting to serve about 40,000 on House Bill 2. And again, that number is actually going to be updated this year because our area plan for New Mexico is due at the end of the year. So again, these are just projected on when our last area plan was submitted. And again, like I said, recently with Title III, that is up-to-date number is $32,375. And that goes for $2.2 million. For Title III, House Bill 2 is $1.1 million. And then Title VI, I think we're up to $250,000. Again, the Title VI is kind of tricky too, because any given time they can increase funding. Yeah. And again, like I said, 90% of our general funds is going towards personnel costs.
Okay, we'll go more into detail on either November 1st, 2nd, or 3rd.
Okay.
We'll be meeting, is it admin one?
I think
Admin one, admin 2, we'll be meeting at that facility in the conference room with HEHSC and Department of Health. Okay, those 3 years.
Could I suggest a date for DOH if you don't mind? If I could, if we could, I would like to have DOH on the second. At the office on a Friday for a procedure. On the third. If you guys don't mind.
That should be okay. Yeah, committee members, I think we're okay with that. I mean, we left it up to Department of Health to provide some information on the agenda and all of that, so.
I'll work with Mitch on that.
Yeah.
Yes, next, committee members, we're trying to coordinate a couple consultation with the Arizona Department of, Health Services. And we'll be done on a time.
All right.
Well, we can host in our building.
Okay, good. All right, so anything with that? So just an FYI. Any other comments, committee members, questions, concerns, issues? We do have a motion, floor, and the motion was made by Honorable Melina Brigade, and then second by Honorable Vice Chair Jermaine Simonson. If there is no questions, comments, any of that emotional outbursts or anything like that, so forth, I will call for a vote. To accept the report from Deltex, Department of Health, and Department of Personnel Management. Again, thank you for the great information. And Scott, and thank you. And just continue to provide that service and provide that technical assistance that you can for the staff here at the organization. So with that, Honorable Curtis Unito. Honorable George Cole.
Green.
Honorable Sal Fernandez.
Green.
Honorable Vice Chair Simonson. Honorable Helena Brigade. So with that, we do have 5 in favor, 1 opposed. And Chair not voting. Wait, did I do that wrong? 4 in favor, 1 opposed, and then Chair not voting. That's 6. So again, thank you very much. Again, you are hereby excused from our Education Human Service Committee. Deltex.
Thank you.
CPN. You guys need to stay here on the next item. But go enjoy the rest of the day. Thank you very much. We'll go ahead and move on the agenda. Okay, so with that. So with that, moving on to item C, report. Department of Personnel Management. Are they here now? Council on Aging? Excellent. Navajo Council on Aging. Honorable Cole.
I think, we're going to go to discuss at the work session.
Okay,
Before, the legislation is being drafted.
all right. Okay, we'll address that when we get to that item. Thank you for that. Thank you. But for now, we'll go ahead and move on to item C. The first, Department of Personnel Management, update regarding the lifting for the COVID leave mandate within the Navajo Nation. Prioritize the health and safety of the Navajo Nation employees. Measures and precautions that should be implemented going forward. Navajo Nation to maintain a safe work environment, recommendation or best practice to navigate Navajo Nation effectively through the transition period. Specific guidelines or protocols to implement. Aligning current policies and procedures with the lead guidance from health authorities and regulatory bodies. Presenters are Thomasita Woody, Human Resource Director, Navajo Department of Personnel Management, and we also have on another here, our Division Director of Human Resources, Debbie Manuel. So with that, the presenters are here. So with that, we will go ahead and provide 20 minutes to you to provide this report. At the end, if you need additional time, we'll make that request, and if we have it consistent, then we'll just give you and provide those additional time. But other than that, the floor is yours. Division of Human Resources.
Yeah, Shimeli. So kind of give you some background, we had, a number of questions that were coming up in the directors meeting, here over the past few months about, what is the status on COVID leave? There's a number of employees that were wanting to make donations of their leave so that family members could use it. And, our office was reminded by General Counsel for President's Office that in May, the emergency, the federal emergency guidelines came to an end. And therefore, the recommendation was to ensure that our policies aligned as well. So with a little bit of communication between General Counsel and then also Department of Personnel, we were able to get the updates done. So I'll pass this over to Director Woody and she can elaborate on it a little bit more. Thank you.
Thank you. Ms. Daniel. Are you? No, okay. All right, really quickly, thank you again. Members of Health, Education, and Human Services Committee. I believe I sent you all a copy of my memorandum this morning, and hopefully you were able to review it, and it gives you an idea of more or less what had been initiated to this point. On October 17th, 2023, there was an update on COVID leave policies that was sent to all personnel, Navajo Nation employees, executive and legislative branches. In this particular update, basically said that the emergency management team on June 15th, 2023. It says, I hereby certify that the foregoing resolution was duly considered by the Navajo Nation Commission on Emergency Management at a duly called meeting at Winter Rock, Navajo Nation, Arizona, at which a quorum was presented at the same, passed by a vote of 3 approved, 0 opposed, 0 abstained on this 15th day of June 23. Heard by President Dr. Blue Nygren and also by Vice President Michelle Montoya. In this particular declaration and the way the policy is presented and had been established by Health, Education, Human Services Committee, stated that according to, and I can give you copies of this. This is just information that was, I think it's for you. This is just information that is on our website and how we initiated this. On our personnel policies and procedures manual, 10 under administrative leave, B paid leave, 3 administration or administrative leave, A COVID-19 leave. The statement in this, it says, this leave will remain available through the duration of any declaration of emergency by Commission on Emergency Management and an information president concerning the COVID-19 pandemic. Basically, once this was adopted, it lifted the mandate. And so we acted on that. So at that point, we basically sent this memo to the employees stating that COVID leave is no longer available. Pursuant to the resolution that was submitted by Commission of Emergency Management on June 15th, and we recognize that. My communication to you as Health, Education, Human Services Committee is to provide you that insight. It's because it changes what the policy is now mandating, which states that, okay, with this lift, in this. We have to acknowledge that this will now impact the COVID leave, the COVID policy, moving forward. I've given you in my memorandum, basically my recommendations and my pros and cons in relation to an overview of the Department of Personnel Management. And do you want me to read this memorandum into the record? Fair?
It's up to you, yeah.
Okay. Okay, let me go ahead and read this into record. It's a memorandum to HEHSC, Fair and James and members of Education and Human Services. From Thomas C. Woody, Human Resources Director, Department of Personnel Management. Date October 23rd, 2023. Subject COVID leave policy overview. We hope that this memorandum finds you in good health and high spirits. We are writing to provide an overview of our organization's COVID leave policy. The Department of Personnel Management's goal is to present a balanced perspective that considers the various factors concerning COVID leave. We have several pros and several cons. One of the pros is employee well-being. COVID leave acknowledges the challenges employees face during the pandemic, promoting their overall well-being and mental health. It reduces stress and anxiety by ensuring employees do not have to choose between their health and their financial stability. Public health considerations, COVID leave plays a crucial role in preventing the spread of the virus within the workplace, reducing the risk of transmission to colleagues and the wider community. It supports public health efforts to control outbreaks and minimize the impact of the various viruses on the population. Number 3, compliance with regulations. Implementing COVID leave ensures legal compliance with local, state, and federal regulations, avoiding potential penalties or legal consequences of non-compliance. We recognize the unique legal framework within which we operate and are committed to ensuring that our COVID leave policy aligns with laws and regulations of the nation, and while also considering the broader legal landscape. Flexibility and adaptability. COVID leave offers flexibility to employees who may need time off due to COVID-related reasons, accommodating their unique circumstances and needs. It allows for effective management of changing situations and evolving during the pandemic. Number 5, monitoring and evaluation. COVID leave enables the collection of data on employee health, productivity, and overall being, facilitating informed decision-making and adjustments to the policy. 2 of the cons. Number 1, operational impact. Providing COVID leave may require additional resources and staffing adjustments to maintain operational continuity. The absence of employees on COVID leave may temporarily impact productivity and workload distributions. Financial implications. Offering COVID leave may result in increased costs for the organization, particularly if employees are entitled to full or partial pay during their leave. Budgetary considerations may need to be addressed to ensure the sustainability of the COVID leave policy. The Department of Personnel Management maintains its supportive position on the matter of COVID leave. We recognize the potential benefits of COVID leave in terms of employee well-being, public health considerations, compliance and regulations, flexibility and adaptability, and effective monitoring and evaluation. However, we also acknowledge the operational and financial implications that need to be carefully considered. I'll go on, and it says pre-COVID-19 and post-COVID-19 considerations. Before COVID-19 pandemic, organizations operated in a relatively stable and predictable environment. Employees typically worked in office settings with limited remote work options. Health and safety protocols focus on general workplace safety, such as fire drills and basic hygiene practice. Sick leave policies were in place, but primarily addressed short-term illnesses rather than prolonged absences due to the pandemic. Post-COVID-19 pandemic situations. The COVID-19 pandemic brought about significant changes and challenges for organizations worldwide. The most notable shifts include remote work and flexible work arrangements. Organizations quickly transitioned to remote work models to ensure business continuity while prioritizing employee safety. Remote work became the norm for many industries, requiring organizations to adapt their policies, infrastructure, and communication methods to support remote collaboration. Health and safety measures. Organizations implemented comprehensive health and safety measures to protect employees and prevent the spread of the virus. These measures include mandatory mask wearing, social distancing protocols, increased sanitation practices, and installing of protective barriers and physical workplace. Number 3, COVID leave policies. To address the unique challenges posed by the pandemic, organizations introduced COVID leave policies. These policies provide employees with additional time off for COVID-related reasons such as illness, quarantine, or caring for families affected by the virus. COVID leave policies aim to support employee well-being, maintain productivity, and comply with relevant regulations. Digital transformation. The pandemic accelerated the adoption of digital technologies and tools across organizations. Virtual meetings, online collaboration platforms, and digital project management systems became essential for remote work and maintaining productivity. Organizations invested in upgrading their technology infrastructure to support remote operations effectively. Business continuity planning. The pandemic highlighted the importance of robust business continuity planning. Organizations recognize the need to prepare for future disruptions and develop strategies to mitigate risks. This includes contingency plans, remote work policies, supply chain diversification, and crisis communication protocols. Employee well-being and mental health support. Organizations prioritize employee well-being and mental health support in response to the pandemic impact. Employee assistance programs, virtual wellness initiatives, and mental health resources were implemented to address and increase stress and anxiety caused by the pandemic. The COVID-19 pandemic significantly transformed the way organizations operate. Remote work, health and safety measures, COVID leave policies, digital transformation, business continuity planning, and employee well-being support have become key focus areas for organizations navigating the challenges brought about by the pandemic. These changes reflect the adaptability and resilience of organizations in the face of unprecedented circumstances. While the Department of Personnel Management maintains a supportive stance towards the retention of our COVID leave policy, we also recognize the importance of understanding the position of Health, Education, and Human Services Committee based on this overview. We value the expertise and insight of the committee and evaluating the various aspects of COVID leave and its implications. We look forward to engaging in a constructive dialogue with the committee to gain a comprehensive understanding of their perspective and to collaboratively work together a solution that best serves the interests of our employees and the community. Thank you for your time and attention to this matter. We remain available to provide any additional information or address any questions you may have. We appreciate your dedication to the health and well-being of our Navajo Nation employees. The end. So that basically provides an overview in our response to information that was brought to our attention moving forward. Thank you, Chair.
Right.
Yes.
How many minutes did you? We might take, right? 5 minutes? Within the 5 minutes? CPM, Division of Human Resources.
Anything else? No.
So waiting the 5 minutes, so that does complete the presentation. With that, committee members, I need a motion in a second. Motion made by Honorable Cole, second, Honorable Curtis Unito. So with that, the question at this point is do you want us to delete the COVID-19 from the policies or leave it there and then just update it? Now, what is it that you would like for us to do as HEHSC? Because if we're gonna make changes and update the COVID portion of it, then either way, whatever it is, we would need to drop legislation. That would be my only question, committee members, any others? Honorable Dr. Inez.
You do. I think there's more to this, because I feel that we don't have some information from our employees directly. Like, whether we're going to continue it, strengthen it, amend it, revise it, I don't know. It's like that in education, you know, we feel, you know, what is best for education, we're all. So, you know, sometimes I feel like we forget voices who should be at the table, and I think the instances are not. And you can easily gain some of that response if you do like a survey, because MIT, DIT has all the domains for all of nomination employees. So you kind of hear their position, because I'm just kind of reflecting on my own position as a nomination employee prior to my deputy official capacity. And then the other thing is the memo itself. It's pretty subjective, and I think it's for that way for a reason, because it's not written by yourself, but just kind of like the shifts, and I quote the most notable shifts in the rest of the statements. So I feel like there's more. I don't know. There's more there, and if we're going to drop legislation, it just, you know, legislation will be time to, so there's a chance to kind of get more information, but enforcement, validity, clarity, those kinds of things that I see for an estimation employee, I feel like somehow need to be crafted or molded within not only what the EPM's position is, but also when such a legislation is put in practice. I just wanted to make those comments. Thank you.
Honorable Cole.
Yeah, thank you. My concern is we should keep this in the book for a while. Because of some staff are getting still COVID. You can check the area of relatives get, you know, come together. One that had a COVID treatment, there's been always not enough, so I would recommend we put this in the books until it goes away. Because we don't want to start another one. Instinct, you know, required. So I would recommend keep it in the books for a while. For a year, because not especially health exercise, we go out into the community. So so I think for me, it's put in the books because this is what chapter means. Chapter be dead. Chapter because when I was chapter official, this is what I saw. So I implemented the resolution. That's where the employees. Anyway, that's just my recommendation. I don't know how to feel. Not me. Thank you.
Yeah, thank you so much for that. Honorable Vice Chair, the right time.
Yeah, thank you. And I also, well, I'm trying to get a handle on this whole COVID thing because on one hand, I mean, I don't want to appear or sound insensitive to it, but it seems to me like, COVID now is becoming sort of like the flu, whatever flu it is that's coming through the year, every year is different. And it's moving into that category. That's the way I'm seeing the rest of the world treating it. And I know we're our own nation here, and I know that we're concerned about the health and safety of our employees and our families as well. But I'm just wondering, and I really, haven't seen the numbers in terms of our nation, in terms of what our COVID numbers are. I don't know that anybody keeps track of that anymore. And then there also used to be a time where they were reporting, this is the COVID rate right now, these are the communities in Tyler. And it's as much, I don't know about hospitalization or even, death due to this, whatever strain of COVID is at now. So those are just questions, some lingering questions I have. And I think, to help strengthen your memo, really, to help you get, I'm sure there's reasons you're doing this, but to help you strengthen that, I think it would be good to have that kind of information in there. The other thing that I saw during COVID times, and again, just because my mother was employed with the nation, was that there was misuse of this COVID leave. I saw times where people might just say, I have a family member tested positive. And so because I was in contact with them, I think, then it was 15 days that you needed to be out, right? So then it was like, I'm going to be gone for 15 days. And then that was it, So there probably is some of that involved in people abusing, those options. How much of that is there, I'm not sure. But I just, I'm just questioning where I think we should pull in more information in terms of, where information back. I don't want to, I'm not trying to dismiss it either. I think it's still a real concern. But we're kind of, it seems like we're at the brink of things here and trying to get that clarity going forward. So I would just ask that you collect some of that information, maybe with the help of DOH or some of the health folks over there. That would give it a well-rounded, picture for all of us in terms of what we're.
Okay, thank you, Honorable Vice Chair. Honorable Yanita.
Yeah, I have a question. Like, we've gone through all this pandemic and a lot of people, they contacted the COVID. And the victims that recovered from the COVID, what are you guys doing for them? Maybe with this legislation, maybe we just need to enhance it to cover the after, I don't know what you call it, the after sex victims. Gee, I want some peace.
But yeah, okay. Honorable Leader, no questions. So with that, I will move back to the presenters. Honorable Sita Woody.
I just want to clear up something here. And the reason why this was, it was sent to me as a request to come before you. The resolution that was approved by the Commission of Emergency Management and the way the resolution and the policy is written for COVID says that once this is approved and enacted, it still takes away the whole COVID policy. I hope that clears up what's being said here. in relation to why I'm sitting before you is to provide you some insight that we've already taken COVID leave out of the policy as established and written by this emergency, Commission of Emergency Management. So by way of providing the oversight, this information, you then have the responsibility to say, okay, is this sufficient? But as far as I understand, the resolution is sufficient. So it's right now, because you have constituents and because we have employees, we just need to make it known to the employees that this is what's going to happen moving forward. If there's additional concerns with a COVID and continuing a COVID leave policy, that needs to happen amongst the oversight. Because how BPM received this on the onset was through resolution. And it went through as approval process. And that's how we ended up with implementing a COVID leave. And then we developed procedures, which the procedures included 3 categories. If the employee caught COVID, if the employee was exposed, or the employee had to watch one of the family members who had COVID to ensure that they were doing well. So those were the 3 areas that we basically said, you know, this part of policy, or as part of policy, this is how you're going to implement it. I hope that clears up where I'm trying to go with it. And since this was brought to me through this meeting, I'm trying to present it to you in a way that, okay, now we've taken it, but now it's back into your hands. If that's what you want to do, then there's other means to follow.
So real quickly, so this COVID policy is already out
Yes.
of DPM,
Yes.
personnel policy, and it's out of them. I don't know, Christina saying it's not. Ms. Toddy?
Yes, thank you, Mr. Chair, and members of the Health, Education, and Human Services Committee. At this point in time, technically, it's not taken out of the policy manual. However, based on Ms. Woody's memorandum, the COVID policy is no longer in existence.
Yeah.
Thank you.
And so that brings me to my next question is, what we need to have an understanding is that when President Biden lifted the whole COVID bill thing, then this should have been lifted. It goes along with that as
Yes.
well. But we as HEHSC have not done a legislation, which I don't know if it requires a legislation to delete it from the Department of Personnel Management Policies Procedure Manual. We haven't done that part yet. So, and we need to do that. But at the same time, she provided this information. So we would need to, depending on the previous HEHSC committee, I don't know how their resolution or their legislation was at that time. If it indicates that once it's lifted, then it's lifted too, that it can be deleted from the policy manual. If it indicates that, then I guess that would happen. If not, then we would come back as HEHSC and then re-implement a new legislation and adopt that new policies and procedures with the new requirements that's before us is how I'm understanding this. Yeah.
Yes.
Okay. All right, let me, Honorable Cole.
Chair, I think when the resolutions passed by the body with the council, that's on. Okay. Can you like the way we died, the legislation over there is interesting. So if you recognize if this body to do away with, then this body will draft the legislation. From there, it'll go away. That's the way my mind, that innocent, not yourself to say, you can't, but still, this body has that ultimate goal, right? Yeah.
So that is right. And so that's what our legal counsel is looking for, to see what wording was put into the legislation from the previous HEHSC committee. If in that previous legislation, it indicates that BPM's policies and procedures, or the Navajo Nation Personnel Policy Manual is what I should be saying, not BPM. Navajo Nation Personnel Policy and Manual. In there, if the previous HEHSC committee's resolution legislation says that it will be lifted once President lifts the COVID, then it will come out automatically. Although if it's not worded that way, it on anything for them to delete it from the Navajo Nation Personnel Policy Manual. Anything for slap. So that part is unclear at this point. We don't know where we stand on that. Well, we have President Nygren over here that lifted COVID and all the stuff that is in this packet.
For sure, excuse me, Chair. For sure, he didn't mention the policy. Do away with the mask. It's an option, that's all he said. He did not include the personal policy. Like many copies stuff way to the king.
Okay. Yeah, you can go ahead on this one.
Thank you, Chair, and members of the committee. So I'm looking at HEHSC Committee Resolution HEHSC JN 0820. And all it says for findings is leave provisions of the Navajo Nation Personnel Policies Manual must be amended to address COVID-19, serious, and then section 3 is just amending the policy, which just chunks in the COVID-19 leave into the manual, and section 4 is a saving clause, and that's it. There's nothing that references the emergency management declaration whatsoever.
Okay, thank you.
Shanella?
So at this point, the way this whole analogy is, Ms. Woody is trying to provide an update. At the same time, I'm assuming to provide a legislation with the updated information that she has been provided to us. And to keep that. So that's what we're at, to update the current policy manual with the current information that we just received from Ms. Woody, which would require a legislation to be dropped. So it is what Ms. Division Director.
So thank you, Shanella. So when we have a lot of requests coming from different divisions and departments, family members wanting to use or donate COVID leave, that's really what this is rooted in, is we need to clarify that, because I'm not aware that there are specific funds set aside for this, but if maybe perhaps at one time there was, but now that that's been lifted, our primary question is to update the legislation, as you said, so that we can continue to follow the internal policies for staff or employees who are wanting to use leave, because that has been lifted, and those federal guidelines change. They still apply to us in some ways. We just need to get an update from the body to say, what do you want us to do? What are your recommendations? Because if there's a lot of instances where people are getting sick, and while even though we have on a national level, we've had all this training to tell us how to take care of ourselves, people are still falling ill, and it's similar to like the flu. It's always going to be around. We just have to do better in a lot of ways, but at the same time, the specific question continues to come to us. Can we use our excessive amount of leave to help another employee or a family member who is an employee? That's the primary question that we're getting, and we need to make sure that we are up to date, or any of the policies are updated so that we can fall in line and figure out how to support it.
So, okay, thank you very much, Division Director. So, in regards to donation of leave, now we're talking about two different things. So I will leave that back up to you guys as Division of Human Resources and DPM on how we want to move forward with sponsorship from any of the Health, Education, Human Service Committee members. I'll leave that up to you guys, working that out. At the same time, now you know where the committee stands as one as being addressed as a survey, updated survey coming from the employees. The data information, updated data information regarding COVID, and then updated COVID information. Absences of leave questions that have been issued by questions and comments earlier. And then the last one is in regards to the recovery. Do we have anything that supports any of our employees that have a recovery period? So those were some of the things that were brought up, and you can address these issues with whoever is going to sponsor the legislation to update the COVID-19 portions of the personnel policy. At that time, I will leave it up to you as a sponsor, and then also as an agent, if you want to include the donation of sick leave, to update that donation of sick leave. If you don't want to include it, then as legislators, you can always make that amendment when this legislation becomes before the committee, and add that at that time. So there's various ways that you guys can move forward with addressing these two issues. So, just an FYI, I believe I will give the floor to Ms. Lowe.
Thank you, Chair. So I have to correct myself. The leave administration for COVID-19 leave, it states in the personnel manual section itself, there's a sentence that says this leave will remain available through the duration of any declaration of emergency by the Commission on Emergency Management and the Navajo Nation President concerning the COVID-19 pandemic. So I do not know if the Department of Justice has given DPM any recommendation as to if that means this section automatically disappears, or if legislation would be required. There's nothing in the resolution that I read that mentions revocation of this section of the personnel manual. So I just wanted to correct that statement that I made. However, I can coordinate with the Department of Justice to see if they've advised anything. So it says, the statement reads, this leave will remain available through the duration of any declaration of emergency by the Commission on Emergency Management and the Navajo Nation President concerning the COVID-19 pandemic. So as the personnel policy is written, right at this moment, that sentence is in there suggesting that the COVID-19 leave is no longer available because the declaration was rescinded. However, these words are, like Ms. Tati said, are physically still in the personnel policies manual. So that is what I'm thinking, where legislation would be needed if you want to remove these paragraphs. Sure.
But there, you have that clear as mud. Honorable Benali.
The first time I remember this calling. Thank you, Mr. Chair, members of the Health, Education, and Human Services Committee and in the Department. human resources. I think it was before the pandemic, I tried to donate leave, sick leave or annual leave, I think it was annual leave to another employee. It was approved in-house, but when it got to personnel, it was disapproved or rejected because there were no guidelines or I don't know if it's policies about the process of donating leave. And the primary concern was the difference in hourly wages that I was donating. I don't know why it became an issue because I was just donating the hours, but it got interpreted to where, you know, I was earning those fringe benefit hours at a rate, and then the person who was donating it to was earning a different hourly wage. And so they said they had to develop some kind of procedure to where they, you know, that donation of these is allowed. But the stickler came to where when the two people are earning different hourly wages. I don't know why that became an issue, but it did, and it was rejected, so, I ended up losing my annual leave hours, and I couldn't, at the end of the fiscal year, or the end of the calendar year, and then, I wasn't able to donate it. Mr. Chair, I just thought I could put that in there.
Thank you. Again, whoever wants to sponsor can work on that. If you want to put it in the provision of the legislation, that donation of leave can be for exempt, can be shared amongst exempt and non-exempt, however the wording is be. That will be up between you, DPM, as being the sponsor. So with that, if there's no other comments, questions, I will give the floor back over to DPM and Division of Human Resources.
Just really quickly, and I'd like to include Paul Spruhan in this conversation. He may be listening. And he, an email was sent to all of you on 10/17, a response from him. 10/17/23 at 2:14. He says in his email, honorable members of Health Education Human Services Committee, DOJ is happy to participate in discussions related to this matter. To add further context, the prior HEHSC had approved COVID leave as an additional type of leave at the beginning of the pandemic. If the employee met certain conditions, including that they or a family member tested positive for COVID, or the employee's supervisor required them to be away from the office due to COVID exposure and COVID symptoms, they could take leave and not have to draw down from their annual or sick leave. The prior committee specifically tied the availability of such leave to the COVID emergency management declaration, stating that the employee would be eligible for COVID leave through the declaration of duration of the declaration of emergency by Commission on Emergency Management and an affirmation president concerning the COVID-19 pandemic. Personnel Policy Section XB3H. As Ms. Woody indicated, the Commission on Emergency Management lifted the emergency declaration on June 15, 2023. President Nygren concurred. Therefore, under the plain language of the COVID leave provisions, COVID leave ended.
Okay. You have to stop.
Employee who,
Yes, you have to stop.
Yeah.
For, from Mr. Sir. Okay, so that's where we are at, in regards to, this report. Again, committee members, I will leave it up to you guys, who wants to be the sponsor and work closely with DPM. To address this area, but it needs to be addressed immediately as soon as possible. So Asian can possible the Asian sponsor that would require working with DOJ as well. So then we'll figure things out, which again, working with our legal counsel as well. So Asian then sponsor all stations. Fishing then they front the top seat be of course they can be impossible. So what end of it, so that will be our request to you as DPM to find a sponsor of the legislation to be drafted and then work closely with the information that was addressed by committee members. Again, that was surveys, update data information, update COVID information, and then also the recovery period of COVID-19, and then again, the donation of sick leave, understanding of sharing of exempt and non-exempt. So you will have your own little mini work session as a sponsor and as an agent. You'll have that information to gather. But it is with that, that's where we are at, and just work closely with Ms. Lowe as well, and we'll move forward in that fashion. Are there any other questions? Committee members, so with that, we do have a motion. Motion by Honorable George Cole, and then second by Honorable Unique. If there is no other question, I will call for a question. Presenters don't have anything. Committee don't have anything. We'll call for a vote. Honorable Unito. Honorable Cole. Honorable Hernandez. Honorable Simonson. Honorable Hernandez Brigade. So with that, we do have 5 in favor, 0 opposed, and chair not voting. So with that, again, thank you very much for that information. Thank you for the emails. Thank you for the hard copies, and let's see who gets sponsored with this legislation. Ella, thank you. We're hereby excused, I believe. There is nothing else that you hear that we would need to care for. Again, thank you very much. Actually, now that I'm on that. Then staff of GP, and thank you for being with us as well. Sorry, we took away your time away from your duties and your high paying position that we had to pull you away from. Thank you very much. God bless you. Have a blessed afternoon. Thank you. Go in. So with that, we will move on to the next item, which is item B report, which is data collection for 2024 to 2028 reinforcement study. Presenters are Christine Lowe, our principal attorney, Central Enrollment Board, the senior research analyst, Office of Educational Research and Statistics. Please, DJ, let me go report. With that, I will provide you 20 minutes to provide us the information of the report. And then from there, we'll talk about motion in a second, and then if there are questions or comments that we can be made. So the floor is yours.
Thank you, Chair. Thank you, members of the committee. So, okay. I emailed the report out that was prepared by Jody. I think Mr. Tracy prepared it, but he's not available today. He's on leave. So I will do my best to walk us through the report as I understand it. We have some copies that we're going to pass out. Thank you. I'm going to make copies. We have some copies here. Let's see what a great job I'm doing. Okay, So I want to start with the report that shows the numbers. It's a 2-page document, or I guess it's 3 pages. But it shows the numbers of enrollment by the different schools. So what you have is, right, so we'll start with the first one, Anna. One of the issues that came up was the some of the chapter affiliations were unknown. And you'll see for Anna, school number 1, that there are 14 chapter affiliations that were unknown by the school. And then in the second column there, you'll see total enrollment for school year 23 through 24. And there's a single number, 94. That means that the total count of adding up all of the enrollment by chapters, and that includes unknown, as well as the total enrollment reported, those were exactly the same. As you can see, as we go down the column, some of those numbers. So say for example, number 2, line 2, BACA. We have 3 unknown chapter affiliations, and the total enrollment, that's where you'll see 205 is when we added up all, when I say we, I mean Stephanie, and all of the chapter enrollments came up to 205, and the total school enrollment was 207. So we're noting that as a discrepancy as well. So you can see the column for unknown chapter affiliations. You can see the column showing in red the discrepancies between the total count by chapters and the total count as a whole. And then, so for example, if you flip over to line 18, on the second page rather, line 18, Many Farms Community School. So they're showing that they only have 3 unknown chapter affiliations, but counting up all the chapter affiliations yielded 256. And the total of all school enrollments are 313. You'll also note that there are some schools where no data was provided. So let's see, that would be Aztec Dormitory, Rock Point Community School, and Chahajali Community School. And then just to encapsulate the document that you have, there are 8 unknown chapter affiliations. So a total of, okay, so there are 8 unknown chapter affiliations for Bureau operated schools and 8 unknown chapter affiliations for tribally controlled schools, giving us a total of 16 chapter affiliations where it's unknown, the student's chapter affiliation. And then there are 14 student count differentiations between the school enrollment and what BIE reported for each Bureau operated school. And there are 20 student count differentiations between the school enrollment and what BIE reported for each tribally controlled school, giving a total of 34 student count differentiations. And then there are a total of 6 no count provided for tribally controlled schools, and that which differs from student enrollment count listing provided by BIE. So what I am not sure about is this says Jody submitted letters to schools. I'm on the first page, letter capital A, lowercase a. It says Jody submitted letters to schools requesting missing enrollment data as of October 23rd, 2023. So I'm not sure if today was the deadline to get that information, or if today was the day that that was sent, or when we can expect the schools to respond by. And I guess there's also an issue with the unknown chapter affiliation status. It could potentially impact the number of school board seats, including chapter representation. So I guess what has to happen next is that Doty either contacts the schools directly and gets the information, or Mr. Tracy suggests here that PIE verify student enrollment count and resubmit a more accurate report to Doty on behalf of the committee's original request on September 28th, 2023. I know that initially Mr. Tracy mentioned that he felt the data would be more reliable if the information was obtained directly from the BIE rather than from the schools. But he's on leave, so I can't ask him to elaborate on that at all. So, Chair, that's my report. And Cephaline Ms. Roanhorse here is here and available to answer any questions if I cannot, Chair.
Okay, thank you. Committee members, motion made by Honorable George Toth. Do I have a second? Committee members, second, Honorable Curtis Denico. Question, Honorable Toth.
Thank you, Chair, members here. On the first two page. You got Red Spring Day School, 51 chapter. Then you have over to Coleman Road, 64. Which chapter are you counting? Unknown chapter, Kaya. And then you have Red Spring, 51. Who collects this information? Even number 10, the Bayers Cup. That's original, that's where I'm from. We had 3 communities. Little Water, Borrego Pass, Casimir Lake, Smith Lake, 4 of them. I see 0. And then we go down to 18, old Sino Bay School. 126. 126 chapters. Is that what you're saying? Then you go down to 31, also, Green Elementary, 124 chapters. That makes sense. It's just supposed to be extremes. Because you need to know education needs to do correctly. Like Baka is okay. To read chapter, I know. Red Spring, I don't know. There's 4 chapters within that Red Spring. Red Rock, Chichalika, Red Spring, also Pine Haven. That's basically, I don't see the 51 chapter. The Bay Other, but you have 4 chapters. So Rome, I don't know. And go back to Rome Senior. Rome Senior has in case the French there that covers Torion and Thailand. And also some part of Consulate. Anyway, so then he did his job and collected this information. So I don't know who did this. This individual went out there to They need to be out there to get all this information.
Yeah, again, thank you. Committee members, are there any additional comments, questions? Honorable Dr. Indy Nance?
No, I want to wait for the response, because yeah, I don't necessarily understand. I didn't hear, unfortunately. But I also have a question, much about the information. But I'll wait for the presenter's response before I ask the follow-up, if I need to.
Okay, thank you, yeah. So do we have anybody from BIE? Here, present, or on the line from BIE? I think it's very important that, we have BIE here as well. And so I think that a lot of this reporting is coming from our meeting that we had with them on September 28th. And so I too am concerned. I don't know why we have numbers that are over 110 when we only have 110 chapters. That's the part I'm trying to figure out. I think OHO and CNO has 126 chapter unknown chapter affiliations, and then Wingate has 124 chapters. That's 134 chapters. So I think that's a big question to where we need to really sit down with BIE again. And Doty to hash this out and see what for the problem and what the problem is. So that's what I'm understanding. I'll leave it at that, and so I'll give the floor over back to the presenter.
Thank you, Chair. So, okay, so obviously, I explained this badly, and I'm going to try again because it obviously is unclear what this chart is depicting. So I'm gonna try again from the top. Okay, so let's take a look at the first page where it says 1, Anna's Community School. So the total enrollment is 94 students, and 94 matches up with the total enrollment and then the total enrollment by student chapter affiliation. 14, if you go to the column to the left, 14 is the number of students whose chapter affiliation is unknown. So that, if you go all the way down that column, that is telling you the number of students, not the number of chapters. So of that total 94, we don't know 14 students where their chapter affiliation is. And so that, as you can see, it becomes more of a concern if you get to like OHO and CNO, where we don't know 126 out of 127 students chapter affiliations. So that is what the unknown chapter affiliation column shows, but it's not, that's not meant to tell you the number of chapters, that's meant to tell you how many students chapter affiliations are unknown. And then you go over to the right where it says total enrollment. And then when you see the numbers in red, that's where when you added up the students by their chapter affiliation, and that includes the unknown students, that there was a difference between that amount and then the amount BIE reported as total enrollment. Those numbers should all be the same. So if you look at number 4, it says Bright Springs Day School, 60, it's just 64. So the chapter totals and the enrollment totals of students were the same. The problem there is out of that 64, you have 51 students who their chapter affiliation is unknown. And then hopefully, yes, I think, it would be helpful if we did have some additional information from BIE. BIE has been I don't know if they've been all that responsive to Doty. And I'll let Ms. Roanhorse comment on how the schools who have discrepancies were contacted. If you can. I think, is that okay?
Chair.
Thank you very much for the clarification again. Honorable Pope.
What's so hard to do? I know Parade Pass will tell you how many check. Just go to the school, ask the principal. They'll tell you the number of students, even the bus spot. Will tell you a better system they have. This, I don't understand. I mean, we should have, I know Barca has information where the number of chapter, number of students from each chapter, they have a list that will tell you. So I think that's the only way to understand this one. To me, it's confusing. I don't understand. So I think we need to review this before we can do a workshop. I think somebody just called or use the last information. Did you have a chance to go out to the school? I can do better than this. I hate to say that, so. Thank you.
Okay, thank you, Honorable Pope. And so this again for the clarification. We did meet with BIE back in September. And this was one of the discussions. And it kept going back and forth. Or are we gonna get this back and implement information? So this information was retrieved from, what was it again, NASA? NASIS. So AABIE provided that information to Jody. But how it ended up like this is beyond me, and I think that's where we need to find answers with BIE. I honestly tell you the truth, committee members, I think the only way BIE and Doty will work together is if we are there as their oversight. I think that's the only way it's gonna work. Other than that, there's that communication because it's not positive there between BIE and Doty at this point. I think we would need to sit back down with BIE and Doty again, and then figure this all out. Because the way I understand the presentation now is that there is, for Aneth, there is 94 students. And so I would end up minusing 14 students because they have unknown chapter affiliations, which should be the new total enrollment should be 80. Am I doing this right?
I don't think so.
Am I doing that right?
I don't think
Or
so.
does it increase the numbers to 108?
No.
To add 14 to 94?
No,
So it's decreasing,
no,
since there's 14 students that is unknown.
No.
Does that decrease 94? Or is that 14 still part of the 94?
okay, 14 is part of the 94. It's just related to, okay,
So it brings me back down to my next question to like Oho and Sino. That has 126 unknown chapter affiliations, but the total enrollment was 127.
right. So there are 127 kids.
There's only one child.
So there's 127 kids at that school and they're getting instruction. Of that 127, we have no idea. 126 kids chapter affiliations. We just know one chapter affiliation, but there's still 127 kids getting instruction.
Okay, sure. Okay. So that's where we are at. Honorable Doctor, and thank you for the clarification.
Okay, and if I may also have Ms. Roanhorse, who may probably provide a little more details on this, but I will say that, no, it doesn't subtract because you're doing enrollment and then subtracting a different variable, in this case, chapter affiliation. It's like us, where a student is here, and then, but George Hope doesn't know, his chapter affiliation. It was interchangeable. Here's your dad. Okay, so I think. So my question then would be. So while you were preparing this. For example, let's just go to Breezewood Springs Community School, the second page, and I'm using traffic control grant scores as an example of those here. So with Breezewood, you have 95. But I understand 95 is what was reported, and then 92 is BIP reported. So there's two different reportings under one column. But because 2 students did not do it, then did somebody contact the principal guardian, so the guardian, if like, how can you capture that? Like, would be a question for her. The same with the 127, that 102 kids, that one student, how did the school know where that one student was affiliated to which chapter, is why wasn't that same practice done for the rest of the 126? That's a question for BAE, because that would be under their purview here. And the other thing is, I think it would be helpful, Dodi, if you provided perhaps the grade levels that are taught here. Because one of my concerns with reinforcement is schools that get 4 or 5 board members, when you have a non-unit with just 3 kindergartners, because the non-unit is just a kindergarten. In our community school, it's just kindergarten too. But yet, we want to do 5 board members. Right, so I think that would be helpful. And then I don't know, as far as like the no data for Rock Point, like Rock Point Community School. I know it's like K-12. And then Shiprock Northwest High School is 7-12 too. It's not traditionally the 9 to 12 week club. So I think Dodi, maybe you can provide that too. And then don't forget to give yourself some credit and put their information at the bottom, so that we also include that they have questions if they don't do any talking. But yeah, this is it was a little off, but I think that would really help, maybe a separate column on how much BIP was reporting. And then how much was assumed either Dodi, and then unknown chapter affiliations based on student application, or based, I don't know, it was a Don Doe calling the office and said, hey, we're just going to register that. And is it a father or mother's registration, or is it preferred, or like Pablo Pintado? Maybe one of my students goes out to George Tolkien area. Then are you considering that as a regional part of the portion? Because it's just one student. Maybe mom works over there, that's fine. I don't know. It's just, I don't know, it brings up a lot of questions, but those are just some of the recommendations that I wanted to pose here. Thank you.
Thank you, Honorable. Honorable Pope? No. Honorable question? Honorable Benito?
Yeah, I have 2 questions. You know, when these kids are getting enrolled, you know, on the application, does it say chapter affiliates? And then my second question would be like, all these student counts, are they all like, do they have census numbers? What are we counting here? Yeah. You all should have census numbers. Oh, I do that too. Yeah.
Honorable Vice Chair Anderson? Honorable.
I didn't.
Okay.
Okay.
All right.
So then my first, well, thank you for this information. Well, it's getting, doing a little unpacking here. But I'm just, one that's like, okay, why do we need to know where they're coming from? But I understand reimbursement is, I guess, authority. Community and schools. So if reimbursement, I mean, if school board, apportionment for, in a thing or getting school board members, so I'm just trying to get back to the basics of how this all began. And, you know, I'm being reminded by community folks that there was a long, hard fight for local control, which is the basis of, you know, establishing school boards and having school board members. And so we're again at this almost like the COVID situation. We're now at the crux in a time where we're looking at, well, there's only 22 kids at Lake Valley Navajo School. And is there a need for 5 school board members, you know? And so those are questions that we're having to ask. And so I think, you know, this is just, I don't know what else to say, but it's, I mean, it's one of those situations where it's just gonna be as clear as mud, you know? That's just really it, but those are just my thoughts for this moment. It's a long day, and I'm trying to look at these numbers, trying to figure out why, what, 126 chapters, and you added to that complication. Thank you very much. But anyway, yeah, I think you've establishing more chapters somewhere.
Okay. Mr. Nolan?
Chair, of the Health Education and Human Services Committee. I think what might be helpful also is if, Zoe provided the definition of affiliated chapter. And how that data is compiled, and also the enrollment aspect of it, and what I'm assuming that the student has to be enrolled with a CID. Because I remember when my son was in a preschool learning program at Standing Rock, he has to provide a CID to enroll. But I think that definitions might help. And also the variables, like Dr. Diaz pointed out, variables don't really complement each other or support each other.
I can't, for that. So that's the dinner that I give the floor back to you.
Thank you, Chair, members of the HEHSC committee. So the data that we have here was provided by BIE. They use their NACIS, Native American Student Information System, to provide the enrollment count to DODE. So with that, and I apologize for the confusion for the unknown chapter affiliation. Those are completed at the schools when the students are being enrolled. And it does determine whether or not the parents provide that information when they're enrolling their child to that specific school. And so some of the discrepancies that you see here, whatever is entered, whatever information is entered into NACIS. So when we look at, for example, Ojo and Fino, yes, there are not 126 chapters there. But that just says that there's 126 students that do not have a chapter affiliation. So when we look at their data that was provided by BIE, they provided, for example, for Ojo and Fino, they only had one chapter, which was Ojo Encino, and that one child identified. And the rest were unknown, which was 126. But if we look at Anna's chapter, they have two chapters that are, that they have Anna with 73 students that are registered, or their parents are registered with Anna chapter. Red Mesa has 7 of their students / parents that are registered at that chapter. And the unknown, which is 14, which is listed there for number 1. So when I looked at the data that was provided by NACES, it matched, because I had to calculate those numbers to make sure that they were, that they correlated with each other. They did, so they said they had 94 students. So when I did my calculation there, it was 94. But the ones in the red, for example, Baca, they have identified 10 chapters within their school. So Baca Pruitt had 140 students that were identified to be affiliated with Baca Pruitt chapter. Castanera Lake had 23 students. Chachota had 1, Church Rock 1, Crown Point had three students, Little Water 4, Mariana Lake 1, Pinedale 1, Smith Lake 3, Coahuila Lake 25, and Unknown 3, which came out to 205, but BIE reported 207 students. So although there's a slight discrepancy there, it's still a discrepancy, and we're not sure if the HEHSC would like for us to contact the schools to make these corrections. This was just done through BIE, through the NACES system to collect this data. And so we did not contact any of the schools to make these clarifications or corrections. But as far as the tribally controlled schools, for those that had no data, there were 4 schools that had no data. There was a letter that was provided to them by Mr. Tracy.
Information due today.
I think it was sent today.
It was sent to them.
Okay, thank you. Okay, all right. Let me figure this out. All together with the numbers that you have here before us, you're telling us that this is not including the ones that have no data and all that. What we have is we're working with 8,012 students. If I were to just I added up all the numbers under total enrollment that's on the right column. Okay. I don't know what the actual number is. But then you gave another different analogy regarding Baca and the other schools. So you lost me there again, but I guess at this point, this still does not help the committee on how to move forward regarding the reinforcement, and that we would really need to sit down again between Dodie and BIE and then HEHSC. Because at this point in time, I think a breakdown of what was requested from Honorable Dr. Nez would be very helpful by grade level. A breakdown, a real nice spreadsheet would be, I think, very helpful. I think a spreadsheet with the actual total enrollment that or the actual funded enrollment for the school, or however you want to word it, as a first column. That will initially give us an overall number of how many students is actually funded. And then the second column, do another column that would eventually break it down by grade levels. And then the third column would be by breaking it down by the current board members' numbers that they have. So that listing that you guys generated for us, that new board member, the new board members, what was the one, let me give you- name one of them. Sehotso. How's it called, Sehotso one?
One and two.
Yeah, so indicate in the third column, how many students Sehotso one board members are currently overseeing. And I think that would also help the committee on moving forward. On trying to address, and then also again, within Sehotso one, create another column by grade level. So how many students by grade level are they overseeing? And at the end of that spreadsheet, you should have a total number. And then at the bottom, it should also have a number in regards to how much students are being overseen by the new board members. And so I think that small, simple spreadsheet will help the committee determine on how we move forward. I think that's something that would really help us at this point, because right now, it is questionable in regards to how do we do this reinforcement. And we don't have an actual number in regards on how many students should be considered to create a board. I think that's another area. And then how many chapters should fall under these board by the numbers again. I think we can start in that fashion and just work with that document while we try to finalize this enforcement deal thing. Because right now, with what you provided us is not going to help us make that decision or to help us guide you on providing that information on how we should proceed with the enforcement plan. So with that would be my only recommendation. I did ask staff to contact BIE. I also contacted BIE, but they informed me they're out in the field. So I don't think we'll be hearing from them or anybody in person that will be joining us. So with that, Honorable Dr. Anthony.
Yeah, thank you, Chair. So I think the recommendations that were shared can also be either by letter or email to BIE, since they're the ones who actually produce these tables, not Doty. But what it sounds like is they're just kind of double check, and that's why you see like 280 for Pianta Community School. BIE reported 288, but based on the billion chapters that Doty was provided, it actually comes up to 300, right? So the question to BIE is, or to the community school, the answer is like, what happens to the student? And then the other thing I think would be helpful to do is if you do like a trend on enrollment over the last 4 years. Because to me, Baca getting 25 Tuatulé students is pretty interesting, because it's quite a ways from there. Yeah. But if whole area, they see how wonderful our Crystal Community School is doing, and they come all over this way, and we see a trend of like 50 of those students, then does that make us consider a board member from that region? You know what I mean? And the South Soil 1 and 2 is interesting too, because there's like lacks in the geographical region. Like Chushka is on 1, but they're not with Crystal. But Crystal has to travel all the way up to Low Mountain when there's South Soil 2, but still come. You know what I mean? It's like so interesting how that was produced last time. But I think for us to be a little more effective in understanding our role in developing the reinforcement, it would help us the trend data as well to see if there's been an increase or a decrease, because even again, I don't remember just 3 students at 100. That's low, way low. And so that's just maybe perhaps a recommendation. As well.
Thank you. That's a good recommendation again. We'll try it in this way. If not, then maybe we have to just do it on government, do it on government to government. As HEHSC making that directive to, BIE. And not having those do the work for HEHSC. But for some reason. That relationship can't happen, but we'll give this a try. And see what kind of information we get back from BIE again. It coming and you making the request from them. If we can't get some accurate information, then we'll just move forward and try to address it as government to government from Health Education and Human Service Committee directly to BIE. Ashe does it, only. So that would be another recommendation. Honorable Vice Chair Simonson.
So the last time we met with BIE, they just like the custody commitment on. And you can correct me if I'm wrong, but this is what I heard BIE saying. They don't want to have much to do with how we arrive at this reapportionment plan. They're basically saying, you're the tribe, you're the one who decides this. We just go along with whatever your plan is. So we don't necessarily, want to be involved in, how you arrive at this reapportionment plan. But you have Dodie, that's why you have Dodie, that's what I heard from the comments. And then, or that, that's my conclusion anyway. And it was, okay, so if it's between you, Dodie, and how you create this reapportionment plan. That was what I heard from them. There was a second piece to that. Then the comment thereafter she made was, well, we checked in with our schools and actually they like the current reapportionment plan. And one of the comments she made was because they said that, one of the schools said that they liked, or one of the school board members said that they like how they are hearing about all the different schools and how they're handling, say certain situations like like hiring and all these different things. And it gave them an idea of how they could, approach things differently within their local school. Whereas when they were just meeting within their local school, they were just it was just very local and they didn't have any interaction with anybody else outside. But when they got into this bigger board and they were now meeting at different schools, they were now starting to see ways of, how schools are differing. That's what I heard BIE say. That was their kind of conclusion, I guess, after visiting with their BIE schools. And so those are just two things that I got from that meeting, and you can correct me if I'm wrong.
Thank you. Honorable Helena, let's begin.
Exactly what, Sister said, yeah, I can say that, but, and yeah, he also said, I think, might ask that, just for their school. That they said they can also, the BOSBA probably has all this information that they don't want to go with us too. And I know at the beginning of the school year, they have student count and each of those children would bring home a little, a federal little thing that they do the student count is with the census number and the resident where they live and what chapter they're affiliated with. And the school should have all that information. It's probably not the principal, but we can try to raise them. That's it.
All right, thank you, Honorable Vice Chair, and then Honorable Helena Gates. Another thing that we would probably need to work on as is, it was mentioned that by BIE is in regards to who they're working with. And right now, the information that they have on their table is that they work directly with, officer president and vice president, food manager's office. And so that could probably be also a problem and an issue, a concern of why they're prolonging, providing this information. I know that was also provided during our meeting, and we need to also probably contact somebody from OPVP. At one point, we used to have representatives here at HEHSC from OPVP, but with all the turnovers that are happening at OPVP, we just don't even know who the representative is in OPVP anymore. We've gone through three different individuals. So I don't even ask about it anymore. I just gave up on it. So I think that's another thing we need to look into, so. Maybe with Apple, so with that, committee members, are there any questions, comments? If not, we do have a motion on the floor. And again, just create that new spreadsheet. Again, in that spreadsheet, it was also indicated to see if you can provide some trend going back, you say 4 years, 4 years of student enrollment. Again, ability make another attempt on saying what the outcome will be to justifying this. I believe you do have this memo already spelled out here. And then how it indicates different areas of where we should come in and get a response and see how they respond to you in regards to this. Because I highlighted the different areas and I want to see how they respond to you as build and control how we need to go through after that. As maybe as government to government, or we drop some sort of directive to OPVP to either rescind that letter that was put in place, or they BIE should only be communicating with the OPVP. So any other comments? If there is none, Oyo should not forget that. Oyo the apple pie, yeah, they Oyo the apple. So Ella, we do have a motion made by Honorable George Toth, and then second by Honorable Curtis Nito. If there's no other questions, no response, nothing, none, I will call for a vote to accept the report that was provided to us regarding the data collection for 2024-23 enforcement study. Honorable Helena Nez Gate. Honorable Vice Chair Jermaine Simonson.
Green.
Honorable Dr. Nez. Honorable Toth. Honorable Curtis Nito.
I vote in favor.
So with that, we do have 3 in favor, 2 opposed, and the chair not voting. So with that, we do have adopted the report D. So with that, we'll move on, and then we just come to the directors and recommendations as well. Ella, thank you again, presenter. So with that, moving on to item E, report. This was your recommendations from committee members to have this discussion at the work session. So with that, we will skip item D. There's no action on item D, and we'll take care of this at the work session on November 1st. So with that, moving on to item number 6, old business, there is none. Item number 7, new business, A, travel, NAFL area Indian Health Service budget formulation fiscal year 2026, Panera Connect Conference Center, November 28th and 29th. Need a motion in a second for us to do this travel. Motion made by Honorable Dr. Kennedy Nan, and then Honorable Dr. Curtis Nito. Are there any questions, committee members, in regards to this travel of regarding NAFL area Indian Health Service budget formulation fiscal year 2026? Honorable Toth.
I'm watching that.
Oh. He said he's gonna charge on your phone.
Oh, and he's saying.
No, he didn't say he was gonna cover your lodging. Charge on
No, we're gonna all charge it to you, the big rich man. Oh, yeah. Yeah, I'll give you.
So, motion made by Honorable Dr. Andy Days and second by Honorable Curtis Unito. Are there any questions pertaining to this travel? Comments none, if not, I will call for a roll call vote. Honorable Unito,
Vote green.
Honorable Toll,
Green.
Honorable Dr. Nez, Honorable Simonson,
Green.
Honorable Nancy Gay. With that, we do have 5 in favor, 0 opposed, and chair not voting. Thank you. Moving on to new business. Item B, request by Connect College to host a HEHSC Health Education Human Service Committee meeting at Salem Main campus. Proposed is the annual report and then future goals, advocacy work at federal and state level. Select date on November 23, November 3rd is not available. Do we have, I thought I saw, what's my name from the next college earlier. Oh, right there. You had your head down. Okay. So with that, what day, shall we have a meeting at? Maybe November 20th? Remember, we only had, how many, what was it? Remember, we only had 9 more Mondays. Oh, Christmas. FYI. Yeah, Mr. Nolly?
November 20th, we, tentatively agreed to, meet with Thursday medical time for their annual report.
Ooh. Hmm. 13th. It could be the 13th. So we will be meeting November 13th, November 20th, and November 27th. 6 ain't got November 16th. How about we can see November 20th? When's your Thanksgiving dinner
But,
for the cafeteria?
we have a very good Wednesday, 25.
Yeah, it's good.
If you want me to provide, it's just doing one for you for the meeting.
November 20th.
Thanksgiving dinner. They were gonna do- we can do the Tuesday. Or Tuesday.
But you won't be here November 20th?
I'm going to sit in Richfield High School.
November 20th.
I don't know. But that far and then.
You are, it's that's.
Well, I mean, I'm the building, yes, yeah.
So November 20th, is it okay?
I'm okay.
November, I guess we can do it on November 20th
Where,
at Salem.
okay, now that is right.
No, we never said that we were going to meet at Salem, so that their request on here is to provide the report. They still can provide a report on November 20th.
I thought they wanted something there.
But I was aware. The only thing I recall is that they want to provide us with annual report.
Correct.
Yeah.
Just the annual report, they didn't say.
They
So
didn't say-
they can come out to.
Yeah.
All right.
So November 20th, is that okay? Steve? So November 20th at, St. Helene, to the request of the net college. Okay, so November 20th. So that would be at the net college. Again, I think, superintendent, college, and models, great trip to that age. So I know she recommended. Okay, so, any questions in regards to the net college, hosting us on November 20th? Hosting Health Education Human Service Committee. If there is no question, and we have, confirmed information from the college. Identical, motion, can I have a motion? Motion made by Honorable Curtis Anito, and then second by George Toll. There's no questions, so I will go straight to roll call vote. Honorable Nancy Gay. Honorable Simonton.
Green.
Honorable Dr. Nez. Green. Honorable Toll. Green, sir. Honorable Unito. Green. With that, we do have 5 in favor, 0 opposed, and chair not voting. So with that, we did 20 in at the next college. Okay, going on to next item 8, close the meeting announcement, adjournment, next meeting travel, October 26, 27, the BOZA 2023 fall conference at Connect College, Connect Conference Center. I will be there on the 26th, presenting again regarding the reinforcement update. And then November 1st, 2nd, 3rd work session with NDO 8, NDSS, and Doty. Location will be admin 2. Admin 2 in Wonder Rock, Arizona. Next one is November 20th, South Florida Medical Center annual report. We will place that on November 20th agenda, and that will take place at the Net College. November 28, 29, National Area Indian Health Service Budget Formulation Fiscal Year 2026 at the Point Arrows, the Net Conference Center. Follow up with IHS and Crown Point to provide a report at future HEHSC meeting. Follow up with IHS located in Red Mesa, Arizona, to provide a report on the future HEHSC meeting. So, 8 days with that, so it'll be nice to probably get all of them at the next college. Get it out of the way. And so 8 a.m. with that, so those are the announcements that we have for us. Committee members, are there any other announcement? Friday, or is there something going on? Honorable Nancy Gay. I forget the title. The state of Arizona is doing something, what was it? Yeah, state legislators, state tax force meeting, I think it was.
Yeah.
In Phoenix. There you go. That's what- Yeah, thank you. That's going on Friday. And then Friday, October 27th, homecoming. For Granada High School. Versus, Scout. Hornets will sing the Scout away. That's my announcement. So with that, if there's no other announcement, committee members. We will adjourn. So with that, I will call for a motion to adjourn at 4:37 p.m. Motion, Honorable Curtis Nito, by the second. To adjourn, Elena Nez Begay. With that, committee members, are there any questions to adjourn at 4:37 p.m.? If there is none.
Sure, you sure that,
Still at Western. Okay, so motion made by Curtis Unito, second made by Honorable Elena Nancy Gay, excuse me, Honorable Unito. So with that, motion to adjourn at 4:37 p.m. Roll call vote, Honorable Yanito. In favor. Honorable Joe. In favor, yes. Honorable Dr. Nancy. Honorable Vice Chair Simonson.
Green.
Honorable Lena Nancy Gay.
Green.
With that, we have 5 in favor, 0 opposed, and chair not voting. We are now hereby adjourned at 4:37 p.m. Thank you, committee members, and have a nice evening. So forth. And we do have a meeting, right after this attorney privilege meeting, just HEHSC committee meeting. So we can have everyone excuse themselves, we have attorney, council privilege, meeting that we need to have. Ada, yeah, so thank you everyone that's been here with us. It's been almost 5 p.m. Attorney time privilege meeting. All the HEHSC committee members should be in here and our attorney
And
and Dodie.
and there.
I don't know where Dodie's attorney went. Okay.